Narcotic analgesics, also known as opioid analgesics, they are the class of the medication that relieves pain by binding to the opioid receptors in the brain, spinal cord, and other areas of the body. These receptors are involved in the perception of pain, and when they are activated by narcotic analgesics, they can reduce the intensity of pain signals. These are the pharmacological agents which relieve the pain associated with burns, fracture, etc. by affecting the degree of consciousness slightly by producing narcosis, and these are known as narcotic analgesics. Some common example of narcotic analgesics includes morphine, codeine. Narcotic analgesics are the powerful medication that can be very effective in relieving pain, but they also carry risk of side effects. Now, pharmacological action of morphine. Analgesia. It decreases pain by decreasing the sense of pain, that is, it produces analgesia. Euphoria. In the absence of disease, morphine is consumed in therapeutic doses. It produces the sensation of well being, which is known as euphoria. If the individual continues the drug to enjoy euphoria, this will lead to addiction. Sedation. Morphine produces drowsiness, which is known as sedation. Hypnosis. It produces sleep in large dose, and the sleep is not related to the natural sleep. On respiratory system, it depresses respiratory center. On respiratory system, it depresses respiratory centers which are present in medulla oblongata. On curve center, it depresses curve centers and produces antitussive action. On CTZ center, it stimulates the chemoreceptor trigger zone. It decreases tone motility and peristalsis in gastrointestinal tract and produces constipation. On eye, it produces pinpoint meiosis. Acute morphine poisoning. The acute morphine poisoning results from the overdose, either accidental or suicidal. The signs and symptoms of acute morphine poisoning includes respiratory depression, pinpoint meiosis, coma, or death. The treatment includes drugs, naloxone and nalorphine, hospitalization and gastric lavage, endotracheal incubation, forced diuresis, administration of intravenous fluid, and prophylactic antibiotic. In hospitalization and gastric lavage, if the patient is conscious or if within the 3 to 4 hours of after ingestion the patient is hospitalized, the vomiting can be induced by syrup of ipecac or concentrated salt solution. If patient is unconscious, simple stomach wash is done to removal of gastric content. Endotracheal incubation. If respiration slightly affected, oxygen is given by nasal catheter. It is done when the spontaneous respiration is needed. Forced diuresis, mannitol furosemide are used to increase the excretion of the drug. Administration of intravenous fluid. After the administration of forced diuresis, there is dehydration, and to prevent the dehydration, there is the administration of intravenous fluid. Prophylactic antibiotics. Prophylactic antibiotics are administered to decrease or to reduce the infection. The give reason includes, first one is morphine produces constipation, or tincture of opium used in diarrhea. Tincture of opium contains morphine. Morphine reduces the tone motility and peristalsis and produces constipation, and in diarrhea there is increase in the tone motility and peristalsis, and morphine decreases the tone motility and peristalsis in GIT. Hence, it is used in the treatment of diarrhea. Morphine is contraindicated in children, old age people, and pregnant women. In children, it depresses the respiratory center and causes severe respiratory depression. In old people, It produces bronchial asthma by depressing the respiration. In pregnant women, it crosses the placental membrane and depresses the fetus respiration. Morphine contraindicated in bronchial asthma. In bronchial asthma, there is the constriction of bronchi, that is, difficulty in respiration. Morphine depresses the respiratory centers which produces bronchoconstriction. It worsens the condition of asthma and may result in death, and hence it is contraindicated in bronchial asthma. Then euphoria leads to addiction. Morphine reduces pain associated with burn and fracture, hence it is good analgesic. When it given in therapeutic doses, it produces euphoria, which means sensation of well-being. If person continues the drug to enjoy euphoria, it leads to addiction. Then nalorphine used in morphine poisoning. In morphine poisoning, there is a respiratory depression, bronchoconstriction, pinpoint meiosis, and constipation. Nalorphine is partial antagonist and it reverses the above conditions, hence it is used in morphine poisoning. Then morphine should not be given in abdominal pain before diagnosis. Morphine is a narcotic analgesic. If given in the abdominal pain, it relieves the pain and interferes in the diagnosis and judgment. Hence, morphine should not be given in abdominal pain before the diagnosis. Morphine is slightly contraindicated in brain or head injury. Morphine, if given in head or brain injury, it increases the cerebrospinal fluid pressure and worsens the bleeding. It depresses respiration, it causes pinpoint meiosis, and it worsens the condition. It is contraindicated in brain and head injury. This is all about the narcotic analgesics, which includes the pharmacological action of morphine, analgesia, euphoria, sedation, hypnosis, respiratory center, acute morphine poisoning, and some important give reasons. Now, non-narcotic analgesics, which are also known as antipyretic. The non-narcotic analgesics are the pharmacological agents which relieve the pain associated with joint pain, toothache, etc. by acting on central nervous system without inducing narcosis. Hence they are called as non-narcotic analgesics or antipyretics. Non-narcotic analgesics. Antipyretics. Antipyretics are the pharmacological agents reduce the elevated body temperature. During the use of antipyretic, it was found that it also relieves the pain. Hence, these are called as antipyretic analgesics. Example, paracetamol and aspirin. Pharmacological action of salicylate. Analgesia, it relieves pain associated with joint pain. On gastrointestinal tract, it produces gastric or peptic ulcer. On respiratory system, it stimulates the respiratory centers present in medulla oblongata. On chemoreceptor centers, it stimulates the chemoreceptor trigger zone. It stimulates the chemoreceptor trigger zone in the brain and thereby produces vomiting. Antipyretic action, it reduces the elevated body temperature, and on blood system it decreases the platelets formation and prolongs the bleeding. Acute salicylate poisoning. The prolonged administration of salicylate in the treatment of rheumatoid arthritis may result in acute salicylate poisoning. Signs and symptoms include nausea, vomiting, acid-base imbalance, gastritis, peptic ulcer or gastric hemorrhage. Treatment includes hospitalization and gastric lavage, administration of intravenous fluid, alkalization of urine, metabolic acidosis, administration of sodium bicarbonate to reduce the body temperature, and external sponging is done with cold water.
Hypokalemia can be treated by intravenous administration of potassium. Diuretics are used to increase the excretion of salicylate, and vitamin K is given to treat the gastric hemorrhage. Thank you so much for being there.